Getting sick or injured in a foreign country is a universal fear. In China, that fear is compounded by a medical system that operates on a completely different set of rules. One wrong turn and you're lost in a maze of bureaucracy when you just need help. But it doesn't have to be a nightmare. With the right map, you can navigate China's healthcare system efficiently, affordably, and with confidence. This is that map. Hey everyone, Joe here, and welcome back to the Middle Kingdom Code. This channel exists to be your practical guide to life in China. We tackle the complex, the confusing, and the critical systems so you can handle any situation. If you live here, travel here, or plan to subscribe, this is the kind of essential knowledge you need in your back pocket. Today, we're readdressing a fundamental need: how to see a doctor in China as a foreigner in 2026. We're recovering the three-tier system, the exact step-by-step process, the cost, and the crucial phrases that will get you from panic to prescription. Let's demystify it. Your journey to getting medical care in China has three clear paths. We'll call them the quick fix, the full service, and the emergency protocol. Let's start with Path 1. The quick fix: international and private clinics. For most non-emergencies, this is your first and best stop. Think things like the flu, a minor infection, a sprain, or a prescription refill. So what are they? These are clinics like United Family Healthcare, or Raffles Medical, or even the local high-end VIP departments that are sometimes attached to public hospitals. The big advantage here is that the staff often speak English, the environments are built to Western standards, and they frequently accept international insurance directly. The process for 2026 is super straightforward. First, you book an appointment. You can usually do this through their official app, their WeChat account, or just by calling them. Same-day appointments are often available. Second, you arrive, register with your passport, and pay the consultation fee. This typically runs between 800 and 2000 RMB. Finally, you see the doctor, get your prescription, and then pay for any additional tests or medication right there on site. The bottom line for this path is that it's fast, it's comfortable, and it completely eliminates the language barrier. The downside is that it's also the most expensive route if you're paying out of pocket. Now for Path 2, the full-service public hospitals. This is the real system. This is how the vast majority of people in China access healthcare. It's incredibly affordable and comprehensive, but it requires you to follow a very specific script. So, here is your 2026 play-by-play for navigating a Chinese public hospital. Step 1 is choosing the right hospital. You want to look for large Tier 3 hospitals. In Chinese, that's 三级牙甲. These are the top-tier facilities, especially in major cities. Some of these big hospitals even have dedicated international departments, or 医部, which are designed to streamline this entire process for foreigners. They're a great option if you can find one. Step 2 is what I call the registration dance. You need to find the registration office, or 事务处. You'll go there with your passport. They'll ask you what department you want to see. You'll pay a small fee, and they'll give you a numbered ticket and a slip with your doctor's room number. Now, here's a massive pro tip for 2026. Most major hospitals have their own official WeChat mini program. Use it. You can often register. Pick a doctor and a time slot and pay in advance right from your phone. This lets you bypass what is often the longest and most confusing line in the entire hospital. Step 3 is the triathlon of care. I call it a triathlon because it involves 3 distinct stages. First, you go see the doctor. Find the waiting area for your department. Wait for your number to be called, and then go in. It is a huge help to have your symptoms written down in simple Chinese or have a translation app ready. A key phrase is 我有, which means I have, and then your symptom. 无 that means, for example, fever, headache. After seeing the doctor, you'll move on to stage 2. The doctor will give you a slip of paper for any tests or prescriptions. You have to take this slip to the payment counter, or 事务处. To pay for everything, you pay before you get the service. Once you've paid, it's on to stage 3. You take your paid receipts to the respective departments. You go to the lab for blood work, radiology for an X-ray, or the pharmacy for your medicine. And very often, once you get your test results back, you have to return to the same doctor to review them and get the final diagnosis. It seems complicated, but it's a very logical, step-by-step process once you understand the flow. Finally, we have Path 3, the emergency protocol. This is for a true, life-threatening emergency. The number you need to know is 120. That is the national ambulance number in China. When you call, be prepared to give your location as clearly as possible, ideally in Chinese. If you can't, try to get a bystander to help. The ambulance will take you to the nearest public hospital emergency room, which is called an. When you get there, have your passport and any insurance information ready. The good thing about an emergency room is that care is given first, and the paperwork comes after. They will stabilize you before they start asking for payment. Now, beyond these three paths, there are two non-negotiable essentials for living in China in 2026. First, insurance. Do not be in this country without comprehensive international health insurance that explicitly covers mainland China. Before you buy a policy, verify if your provider uses direct billing or 直服务. With private clinics like US, direct billing means the clinic charges your insurance company directly. If not, you'll have to pay upfront for everything and then claim the money back later. No matter what, keep every single receipt, invoice, and piece of paperwork from your visit. You will need it. The second essential is your digital toolkit. On your phone, you need to have a translation app like Pleco or Google Translate, using a VPN, ready to go for medical terms. You should also have your emergency contacts, your address in Chinese, and your blood type saved in your phone's notes or medical ID. And finally, have a trusted Chinese-speaking friend on speed dial. Just knowing someone is a call away can make a world of difference. Look, knowing this system isn't just about treating a cold. It's about having peace of mind. It's about building the confidence that no matter what happens, you have the agency and the knowledge to get the care you need. And providing you with that foundational confidence is exactly why the Middle Kingdom Code exists. If this guide just lifted a massive weight of uncertainty off your shoulders, I need you to do three things to help our community. First, please hit that like button. It signals to YouTube that this is vital information that needs to be pushed to every foreigner who is in or coming to China. It's a simple click that could make a huge difference for someone. Second, subscribe to the Middle Kingdom Code. We have deep dives on insurance, mental health resources, and so many more critical living guides coming up. Your subscription ensures you are always prepared for whatever China throws your way. And third, share this video immediately. Share it in your expat group chats, with your new colleagues joining from abroad, on your social media. You are not just sharing a video, you're providing a lifeline that could genuinely help someone in a moment of crisis. Your health is your #1 priority. Now, with this guide, the system doesn't have to be your problem. Thanks for watching.